we can stick to the standard recommended evidence-based clinical test procedure, which involves a single application of pinprick to the hallux as follows. A disposable pin should be applied just proximal to the toenail on the dorsal surface of the hallux with just enough pressure to deform the skin. Inability to perceive pinprick over either hallux would be regarded as an abnormal test result. Or, if preferred, we can employ a technique that is a little more sophisticated. Everyone's perception is idiosyncratic and state dependent. Therefore, we can detect subtler, earlier deficit by using the second rule of clinical examination: comparison. First, use a Medipin to establish normal sensation in an area you know to be unaffected by pathology, for example the back of a hand or tip of a shoulder, by using multiple light applications in a continuously repetitive percussive action. This is vital, as repeated stimulation promotes both temporal and spatial summation to establish an average for the patient, narrowing the standard deviation created by operator error and simultaneously negating the missing out of randomly distributed receptors. Standardization can only be achieved by manipulation of patient perception rather than by attempting to regulate the instrument, no matter how well it unifies consecutive applications. Whilst doing so, you can tell your patient that this is normal for them. Immediately move to the area under suspicion, and rather than ask if they can feel it or not, simply ask them if it feels the same. This makes the test quantitative rather than just a threshold-driven yes or no response. You can easily move back and forth between areas to help refine the response. You can even grade their responses by setting normal at an arbitrary 5 out of 10, allowing them to offer a specific comparative value. Patients are very good at expressing subtle differences with verbal feedback in either direction, hypo or hyperesthetic. Remember, each application is imperfect, and it is the continuous application that reduces the standard deviation and produces a more reliable picture. When a different observer, operator, repeats the procedure on the same subject, it is a simple matter to re-establish the new normal with the identical process. Furthermore, intra and inter-operator test reliability can be significantly facilitated by use of a rapid, repetitive application technique to iron out random variations in application pressure and nociceptor distribution. On those rare occasions when a Sharps container is not handy, did you know that Medipin can be rendered safe simply by compressing the point against a robust surface? In short, pinprick will often be the first modality to be lost and the most easily assessed accurately, providing the correct technique is employed.